Psychosocial assessment on Heather McEwen. Her chronic illness and disability diagnosis is lupus. So Heather was recently diagnosed with lupus and was referred for mental health services. Lupus is a long-term autoimmune disease in which the body's immune system becomes hyperactive and attacks normal, healthy tissue. Symptoms include inflammation, swelling, and damage to the joints, skin, kidneys, blood, heart, and lungs. Heather McEwen is a 30-year-old Caucasian, non-Hispanic female who is married and currently living with her husband and 2 dogs in a U.S. military Coast Guard base housing in Kodiak, Alaska. Her insurance is through TRICARE Prime Remote for active duty service members. She speaks English only and is middle class. She resides in a 2-bedroom duplex that does not have central air or heating. She was originally born in Jacksonville, Florida, and she's been struggling with the change in climate in Kodiak, coming from Jacksonville. So, her TRICARE PCM, which is her primary care manager, requested that our clinic conduct a full psychosocial assessment because Heather appears to be blaming the military-based housing environment and conditions on her developing lupus in the first place. Heather did tell her PCM that she feels as though the U.S. Coast Guard is to blame for her condition and for not remediating the mold in her home on the base, but her husband has asked her not to create problems for him on the base. So Heather's background information in terms of her education and vocational skills is that Heather has a bachelor's degree in human services. She was working on her MSW. She was a caseworker at a children's assistance program for tribal care assistance, and she lost her job and her ability to take care of herself due to chronic joint pain and swelling. She's lost interest in activities that she used to love, and she dropped out of her MSW program. So my observations of her was that Heather reports never really having had any major health concerns. She reports that she was pretty active and she used to enjoy exercising and working out and eating pretty healthy. She reports that she used to enjoy participating in outdoor activities like hiking and camping. At her interview, she appeared to be dressed casually with her hair pulled back loosely. She presented with a depressed mood and affect. Impressions and assessment. Heather reports that she doesn't feel like she can function at all. She reports that she can't do anything because of the chronic pain, and she doesn't want to do anything anymore, and she believes that she is causing her husband a great deal of stress, especially due to the fact that they live so remotely and they have no family in Kodiak, almost no friends, and she has to travel off island for all of her medical appointments by plane, in which flights can take anywhere from 50 minutes to an hour and 50 minutes or more, based on whether she can get a nonstop flight. So she has to fly off the island for care. Heather will need a better support system put in place to help her with managing her symptoms associated with depression as a result of her chronic pain associated with her lupus diagnosis. She's having trouble adjusting to her chronic illness and the culture of Kodiak, Alaska, along with environmental issues associated with the mold overgrowth, the climate in her home and on the island, along with accessibility to health care. Since she's had to make appointments with specialists who are off island and require travel by air, sea, and by car to gain access to those resources. If you look on the side, there's a map of how long it would take to get to Anchorage without flying. Like if you take a ferry and then drive, that's 16 hours. And flights look like they cost about anywhere between $286 and $359. So imagine having to take a flight to get medical care and then drive a long distance. That's a lot. How Heather defines her disability. Heather defines her disability from a behaviorist perspective. Essentially, she emphasizes the environmental factors, along with her current level of functioning, as a direct result of her chronic disability. Lupus is shaping her current behavior. Heather presents with observable behaviors based on her current circumstances. Her chronic pain has led to adverse conditions through which she is engaged in learned behaviors. Since she is in chronic joint pain and she suffers from inflammation, her operant conditioning / functioning has diminished. The biopsychosocial model works best for her. So biological, Heather, who was once healthy, has come down with an autoimmune disorder, which is lupus. Psychological, Heather presents with depression and a depressed mood due to her chronic pain associated with lupus. Social, Heather feels alone on the base and has minimal social support. Her husband has been wonderful during the onset of her health crisis, she reports, but she harbors guilt for his having to take care of her, and she feels disconnected from her family physically, but does acknowledge their support over the phone as building on a once dysfunctional relationship with her mother has been healed by their physical distance. Treatment plan, diagnosis/problem. So her problem and her ultimate diagnosis is Axis 1, depressive disorder due to another medical condition with major depressive-like episodes. Axis 2, adjustment disorder with depressed mood. Axis 3, lupus. Axis 4, inaccessibility to healthcare facilities and inaccessibility of other helping agencies. Axis 5, acculturation difficulty having to adjust to the climate and culture of life on the base in Kodiak, Alaska, and personal history of military deployment with her husband. She also has other personal risk factors related to the mold exposure and climate having an effect on her condition. The problem definition. Overall, Heather presented with a depressed mood most of the day, nearly every day, as well as a markedly diminished interest or pleasure in all previously enjoyed activities every day. She also presented with a reduction of physical movement due to the chronic pain she was experiencing. Heather reported that she has been experiencing a loss of energy every day, along with feelings of worthlessness and inappropriate guilt towards her husband for having to take care of her every day. She has a diminished sense of hope for her future. At this time, Heather reports that she has not experienced any thoughts of suicide or suicidal ideation. Heather's strengths and weaknesses. Heather reports that she was a very positive person prior to her lupus diagnosis. She liked helping others, and she describes herself as a people person. She also said she's very organized. Weaknesses. Currently, her weaknesses are that she's in chronic pain and she has swollen joints which limit her mobility. She's never been in a position where she needed to be taken care of before, and as a result, she's having a hard time coping with not being able to be independent, care for herself, and work. And she feels guilt towards her husband. So, her goals. One of Heather's goals is to learn ways to cope with her illness and possibly eliminate factors that can contribute to her disorder. Right now, she also wants to take advantage of any mental health and medical resources and follow through with her care plans. She's actually looking forward to moving in 1 year, as her husband's deployment in Alaska will change at that time. So she does have a glimmer of hope that a change in environment will help with managing her chronic pain, as well as help shift her depressed moods. So these are the goals that Heather set for herself. Heather wants to learn to accept the diagnosis. Heather wants to alleviate her depressed mood as a result of the symptoms. And Heather wants to learn how to change her diet and listen to what her body needs to reduce the intensity of the symptoms of her lupus. So the strategies or interventions would be cognitive behavioral therapy, or referral to a nutritionist to help with her diet, referral to a physical therapist to help build her strength, range of motion in her joints, muscle performance, gross motor functioning, and balance and coordination. I also thought it would be good to assist Heather in identifying life changes that can take place once she finds ways to cope and manage her symptoms. Assist Heather in purchasing a dehumidifier for her home to reduce the moisture in the home that is exacerbating her joint pain and swelling. Put Heather in touch with virtual support services, specifically inviting her to join Lupus Connect, which is an online community where people with lupus and their loved ones can talk with others and find support. There isn't a chapter in Alaska, and I thought this might help because she feels very alone. She can at least go online and find some support by talking to people going through the same thing she's going through. I'm also going to offer her counseling. The type of counseling would be individual counseling, 3 times per week for an hour. And the reason why I made it so frequent is because she seems to feel alone, and she probably could use that time to talk every day so she can kind of work on not feeling so alone. And also I added on individual mobile counseling, where I would do a home visit 1 time per week to provide Heather with support in her home. Also, so she doesn't feel alone while she's always at home. So lupus and depression actually go hand in hand. Depression is an important manifestation of lupus. In some, it is the presenting sign of the disease. Many patients, and certainly many doctors, wrongfully attribute depression and lupus to having a chronic illness and all that goes with it. However, the disease itself may cause depression. Some of the mental effects of lupus are cognitive dysfunction, depression and anxiety, mood swings, and personality changes. Luckily, Heather's not able to check all of those boxes right now, but the depression and the personality changes have definitely been a part of her overall functioning as she's dealing with this disease.